Yes, I'm sorry about that. We are recording these sessions so that folks that can't make today's session but live in, especially regions 4 and 5, will have access to this material after the fact. So today we will be focused on regions 4 and 5. The next week we will be focused on regions 6 and 7 as the potential receiving sites for a lot of sheltering medically needed patients. Every week, when we talk about emergency preparedness for home care and hospice patients, we have to talk about these things. By law, you as an agency have to have an emergency plan. That emergency plan is not just for hurricanes, it's for all hazards. You have to complete that plan and describe what your response to, whether it's a hurricane, a tornado, whether it's flooding, whether it's power outages, whether it's industrial accidents, all of these different scenarios are possible in Louisiana and Mississippi. And you need to have a plan for each one of those potential hazards to your agency as well as to your patients and your staff. um, you have to submit those plans. There's a template that the departments of health in both states provide us, and you have to submit those plans to your local emergency manager, the emergency manager in either your parish or your county. We suggest LMHPCO. Best practice is that you not only submit it to the emergency manager in the parish or county in which your office is located, but in all of the parishes and counties that are in your service area. Because while emergency management is done at the local level, and every parish, every county, every region, every district in Louisiana and Mississippi does things differently. And you need to know if there are differences in your service area for your patients, what those differences might be. A list of all of the parishes and all the county emergency managers are in this first block, the hyperlinked. The next thing I can't emphasize enough is that it's incumbent upon you to go out and see your emergency manager, talk with the people in that office, get to know them. Not only the office in which your office is located, but our best practice is to know all of the emergency managers in your service area. Again, their contact information is right there in the hyperlinks on these handouts that we give out at the end of each session. Click on there and you'll find their contact information. Take them cookies, go and meet them, because in an emergency, it's all about relationships. And if they know your face and you know their faces, you know who to go to, you know where you can get assistance. That's important. Third, home health and hospice agencies have a gift in terms of the at-risk registry. The at-risk registry is a tool that we created after Katrina that allows home health and hospice agencies to identify those patients who would have difficulty or would not be able to evacuate themselves from their home if there was an evacuation order called for their neighborhood. The at-risk registry identifies who those patients and families are. It puts them in a registry, and every week generates a list for every parish in Louisiana and every county in Mississippi, telling the emergency managers that these are the folks that we're caring for in their homes that would have great difficulty getting out of their home if there's an evacuation order called for whatever the hazard might be. These are weekly reports that we send out, updated by agencies each week, alerting emergency managers of these vulnerable patients. This green block here hyperlinks ABCs. That's a tutorial. The ABCs of using the at-risk registry, a 2-page tutorial. It's easy reading. There's a consent form that patients must sign in order for you to put them into the registry. There's also a one-page evaluation form that gathers all of the information you need on those patients to put them into the registry. Again, there's a Louisiana template, there's a Mississippi template. The hyperlinks are right there. Is someone in your office receiving a reminder from us to update, to do the weekly update? Patients, once you put a patient into the registry, it requires your agency to update that patient on a weekly basis in order for that patient's name to remain on the list that we send out to the emergency managers. Why is that weekly update required? It's required because, especially with regards to hospice patients, 25 to 30% of our hospice patients that are enrolled or die within the first 7 days of enrollment. Half of our patients are deceased by 30 days. This is the only way that we can ensure the emergency managers that we're sending them the names of living patients who are still on service with home health or hospice and would still need assistance this week if there was an evacuation order called. And the reason we do it on a weekly basis is because we never know when emergency situations are going to arise. It's not uncommon for them to arise in the middle of a holiday stretch like we just had with July 4th, or on weekends. We'll get to that a little bit later. The other question that you need to ask your emergency manager is there a particular credential that is required in order to get back into your service area after an emergency declaration? Some parishes, some counties have particular placards, others do not. Some require particular credentials from that agency, others do not. You need to know what the emergency manager in your region, you need to know what the emergency managers in your service area are doing with regards to re-entry after a disaster and what the protocol is. And finally, if there's an evacuation of patients to a different part of the state, CMS expects you to either transfer that patient to an agency that can care for the patient while they're out of your service area, or that you contract with that agency to care for your patient while they're out of your service area. Do you have those contracts? Do you have those contacts with other like agencies in other parts of the state, knowing where your patients are planning to go if there's an evacuation order called? You need to know that about your patients. You need to know that about your staff as well. I remind you that emergencies happen when we are least prepared for them, such as weekends and holidays. We won't get a hurricane between Mondays and Fridays between 8 and 5. You need to plan for weekends and holidays. We just had an extended holiday season with the 4th of July falling on Thursday. A lot of people were out either Wednesday, Thursday, some on Friday, as well as the weekend, made a long weekend of it. Who was minding the store if we had had a direct hit? You saw the damage that Beryl did, and Beryl was just a Category 1, barely a Category 1 hurricane. So you need to remember to take holidays and after hours and weekends into account in your emergency planning. If you haven't done it yet, you need to do a tabletop with all of your employees. They all need to be present. The tabletop is a way of everyone knowing what is expected of them, and administrators knowing where employees and patients are going to go in the event of an evacuation. What are their plans? So you need to tabletop. Right now, I would say hurricanes, but if you haven't done so already. And Allison Hughes with Region 2 graciously gave us recordings of the components of doing a tabletop with your agency, as well as a demonstration of a tabletop. Those are hyperlinked in this slide right here in terms of recordings for part 1 and 2. But use the knowledge that you've had that you've gained from previous emergency situations, because the future is always going to resemble the past. It's not going to repeat the past, but it's going to resemble the past unless there's a total rethinking of that past, as is the case with things like contraflow. Contraflow is not going to be a recommended is not being recommended unless there's some sort of major storm where we have to evacuate from the coastline. Contraflow has its own problems, and we're rethinking all of those scenarios. And right now, sheltering in place is going to be, except for unprotected areas of both states, is going to be recommended through Category 3. So you have to pay attention to what emergency managers are telling you in your part of the state in order to know what the response is going to be in terms of evacuation. Do you have contact information for all of your staff members? Do you know what your staff members' plans are if there's an evacuation order, where they're going? Do you know where your patients are planning to go if there's an evacuation order? When you're talking to your emergency manager, it's real important that you find out from your emergency manager the patients that you might have identified as needing assistance in the event of an evacuation. They're going to be taking them somewhere. You need to know where your emergency manager is planning to take your patients. And do you have alternative ways of communicating with your patients and your families and your staff when and if cell towers go down, landlines go down? There are all sorts of now apps that are out there that will allow you to communicate with a simple Wi-Fi signal. So even if you don't have internet, you might be able to get onto some of these apps used by your agency, both your staff and your patients, to communicate with them, to continue communicating with them. Louisiana is divided into 9 regions. Today, we're going to be looking at regions 4 and 5, which is the southwestern part of the state. I've included contact information for both 4 and 5, but I know folks in there are some providers in region 4 who also service patients down in region 3. So I've included region 3 contacts, and I know that there's some providers up in region 5 that also have patients up in region 6. So I included region 6 contacts on this particular chart. If you are in region 4 or 5, you need this chart included in your current emergency plan. It needs to be one of the pages. And if you are in 4 and 5 in hospice or home health, there are 2 important contacts that you need to know about. Danielle Maples in region 4 and Liz Harmon in region 5. And I think Liz is joining us today. Yes, I see you. Thank you, Liz, for being on today's call. These are the folks that would help you most. They would most help you with your home health and your hospice patients, with the needs of those particular patients outside of evacuation. Including evacuation. So if you have concerns about a particular patient, these are the folks that you want to start talking, making sure that you know who they are, what they look like. Go and meet them. Ask to have a meeting between now and the peak of hurricane season, especially. And just, again, it's all about relationships in a disaster. People, you need to know that you can trust the people that you're dealing with, that they're legitimate, they have legitimate concerns, and that they have to manage a lot of people. And so that's why it's real important that they know who you are. If you're in Region 4, this is a great little tool to hand out to your staff and to your patients as well. It gives you links for all of the emergency alert systems in each one of the parishes, and you can have your staff, download those apps onto their smartphones so that they can get direct communication from their local emergency managers. Also, help your patients who have smartphones download these same apps so that they're getting that direct information as well. For those, if you have patients in Region 3, this would be the handout for the patients in Region 3. I don't have one for Region 5 or 6 at this point, but maybe one day we will have one for every region in Louisiana as well as in Mississippi. I want to talk about the at-risk registry. For those of you who are not familiar with the registry, it is required as part of your emergency plan in Louisiana. It's highly encouraged in Mississippi for home health and hospice agencies. It fulfills your requirements with regards to the conditions of participation to notify your emergency managers about those patients, families that would have difficulty with an evacuation order. It keeps the emergency managers aware of those special needs of your patients that you're caring for at home. This is not a registry for nursing home patients. Nursing homes have their own separate plan for all of their patients. So if you have enrolled a patient who also lives in a nursing home, they would not be a candidate for the registry. But I do want to say that as of today, even though you're using if you're using the registry, we had 76 patients in the registry that were put in there, but they did not assign a parish or a county to their name. Therefore, those patients are going nowhere. And there's another 70 patients that are missing zip codes, and zip codes are really important to emergency responders who are using GPS locators in their vehicles to find addresses. So please pay attention to all of the details that are being requested on the evaluation form if you're going to put a patient into the at-risk registry. The registry is specifically designed for 4 different types of patients who are living alone without a caregiver and are unable to evacuate themselves, or patients who have a caregiver, but the caregiver is either mentally or physically incapable of carrying through on an evacuation order, or patients who are families that cannot afford an evacuation, feel they can't afford an evacuation. The average evacuation before the pandemic was estimated to run around $750. Today, I'm sure it's much higher than that when you take in fuel costs, hotel accommodations, eating for a 3-day, and that's for a 3-day evacuation, which used to be the old rule. Our evacuation times have been lengthening as the damage was more and more, and local officials have to do more and more in order to prepare an area for people to come back into. So that's a 3-day evacuation, that's 750. And then finally, patients that are just plain stubborn, they're refusing to evacuate. And you know who those patients are. I want to remind you that regardless of the reason that you're putting them into the registry, the patient has to give their consent to being in that registry. We send out a reminder every Thursday morning at 7 a.m. to all of the folks that are using the at-risk registry to please do the update today, because tomorrow we are sending out reports to all the emergency managers across Louisiana and Mississippi. Um, and last week we sent out over 1,000 notices. What I want to point out is about 177 were open, but there were 896, almost 900 that went unopened. And that could be because a lot of them are ending up in your spam folder, and you have to go in your spam folder and give it permission to get into your inbox. And others, if you're not seeing that in your spam folder, and it's not getting to your inbox, and you need to contact your company's IT provider and ask them to look at the firewall and give permission for us to get through that firewall in order to give you that reminder each week. We right now we have about 553 patients that are in hospice patients, 553 hospice patients who are in the registry who were not updated last week, and consequently they were not included in any parish report last week. That's 550. We need to get that number as low as possible so that you're not throwing 550 extra people into the mix when there's a real significant threat to the area. We need those 553 patients, either if they're deceased, they need to be taken out of the registry. If they're no longer on service with your home health agency, they need to be taken out of the registry. Or if you're not doing the update, you need to start doing that update each week so that emergency managers know well in advance about that patient's condition. It does them no good to have the patients thrown in at the last minute. These are the hospices in the register that were not updated last week, and consequently, these are the hospices that have those 553 patients that weren't updated last week. If you see your name on this list, or if one of your branches is on this list, please call them, contact them, and let them know that they have patients that are not, their patients are not being included in the register, in the report, the weekly report. And we need to figure out why. They need to send me an email that set up a time so we can look and see what's happening. If they know that they're not doing the update, or they know that they have deceased patients or patients that are no longer on service, that's one thing. But if they think they're doing the update, they may be doing it improperly. And that's resulting in these 553 hospice patients not getting included in last week's report. In terms of home health, there are 430 something patients that weren't included in last week's report. 432 patients, home health patients, weren't included in last week's report because they weren't updated. These are the agencies that have those 432 patients in there that aren't being updated. Here's the rest of the home health agencies. We had about 55, I think it was 55 home health agencies that did not update last week, and about 55, it was almost equal, the number of hospice and home health agencies that have patients in the registry, but didn't update them last week. And today I wanted to specifically look at Region 4, which is Southwest Louisiana, that had a close call with Beryl there. So there are 153 patients that in Region 4 that were identified as needing assistance in last Friday's report. 39 There were another 39 patients in Region 4, which is nice. I mean, it's a low number. Thank you. I appreciate y'all doing some great work, especially the Office of Public Health. I know is doing a lot of work contacting patients and agencies, trying to get them to reduce the number of patients that are not being updated each week. Thank you for your service. But these 1, 2, 3, 4, 5, 6, 7, 8, These are the 8 agencies that have those 39 patients that were not updated last week. That's in Region 4. In Region 5, we had 42 patients identified as needing assistance if there was an evacuation order. But there were more than that. There were 55 patients who had not been updated last week and weren't included on the in the reports. These 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, these 13 agencies or who have those 55 are the folks that have the 55 patients that were not updated last week. They're your patients. You put them in at some point, but they weren't updated last week. And that consequently were not included in last week's reports. Again, if you're on these 2 lists, or either in Region 4 or Region 5, if you're not updating patients on a weekly basis, that's a problem. If you don't know how to, call me, and I'll be more than happy to walk you through the process. If you have patients in there who are no longer on service or deceased, please remove them. That's what's adding to the count of not being updated. Finally, if you think that you're updating them on a weekly basis, but you see your name on this list, it means it's not being done correctly. And call me and I'll walk whoever in your office is responsible for that task through the process of doing a proper update. Having said that, I think Liz, you're on with me?
Yes, sir, I am.
Is anybody else from Region 4 or 5 on today's call?
There's a couple of us on, Mr. Boudreaux.
Yeah,
Sheila
hey.
LaSalle.
Hello.
Hey, sorry, Sheila. This is Tina Stefanski. I'm driving back to the office. I'm on my phone.
Thank you. I appreciate you being with us today. Anybody else in 4 or 5?
Yeah, Mr. Boudreaux, I want to introduce everyone to our team. So you heard Sheila LaSalle. She's our hospital nurse coordinator. So she's a registered nurse. Bally Miller is our emergency preparedness planner in Region 4. And Nikki Guillory is new to our team. She replaced Karen Baroker. Some of y'all may remember Karen. So this is a new Karen and Betsy. Nikki is also a nurse, registered nurse. And she's got the added benefit of having worked in home health for several years. So Nikki and Sheila are doing a lot of work to try to, go through that risk registry and have been checking in with some of you all, regarding your patients. And so I just wanted to say that we're here for y'all. Let us know. Hopefully y'all know how to reach us. Thank you. And Nikki, I don't know if you want to say anything.
No, I've just been reaching out to different home health agencies with Sheila, kind of going over our at-risk registry list. Giving pointers, trying to just get the most accurate information ready weekly. Because some people have admitted that they don't update their registry, but once a month. So just want to reinforce positive behaviors. That's it.
Exactly. Ms. Gilroy, thank you for saying that. I heard that this week and I was like, that's not going to work. This has to be on a weekly basis. Otherwise, the emergency managers will know nothing about your patients. Out of sight, out of mind. I mean, they go through this list every week, looking at those same names and addresses, knowing where those folks are, plotting out some parish emergency managers actually have mappings software that they use to do all of this. And if your patient's not on that list, they come out of the mapping software until they see that name again. So I was really disturbed when I heard that some agencies saw it as a monthly update rather than a weekly update. So thank you for mentioning that. Any other comments before I turn it over to Miss Liz Harmon? Liz, I have your slides right here, and I will advance them as you tell me to advance them.
Great, perfect. Thank you, Jamie.
Okay, let's move. We'll move on.
Okay,
Liz, it's all
Dr.
yours.
Tina, if you want to jump in, just for anybody, I know our agencies cross regions a lot. Whether it's 4, 5, and 6, it's very frequently that you're going to have patients in that overlap. And what I'm going to talk about on this is a reminder about the medical needs shelter, is that this holds true. And what I would encourage everyone is to, as you have a patient that may be going, well, I can do this or that, make sure they understand that a medical needs shelter is not where they want to go. It is definitely a last resort, that it is, you're going to be helped, but you're going to be there with a max of one caretaker, and it's still in I've got a picture, a gymnasium type setup. And you've got great committed public health nurses that are going to start out that treatment there, but this is not what they do every day. And they're going to help. But once again, your caretaker is going to be dependent on quite a lot. So I would just encourage you to really explain to patients the reality. If they choose to, if they think they're going to stay and live, for 2 weeks without power, and that they may end up in a medical needs shelter, and what that entails. So just as an overview, it is it's a refuge for individuals who may not be eligible for general shelter because of their medical needs, but do not require hospitalization. The shelters are last resort. And just please keep that in mind. There's no smoking, no alcohol. Children are going to be allowed to stay if they have a need, but otherwise they're going to have to go to the general shelter. Okay, you can go to the next slide.
Before you leave that slide, I just want to remind providers that if your patients do end up in a shelter, you are still responsible for their care. And you need to make arrangements to have those patients visited in that shelter, either by yourself or through contract with another agency in the area of that shelter. That's really a really important feature that the conditions of participation are very clear about. You are still responsible for seeing those patients in that shelter.
Great point. Thank you, Jamie. Okay, this is what the general shelter looks like. And the medical needs shelter, you've got more space, but once again, you're on a cot, and it's not going to be the most comfortable situation. So like I said, just use this for education for your clients. Okay, we can go to the next slide.
Also, if patients go there, shelters require that the patients come with a caregiver, correct?
Yes, right, Tina, Dr. Tina?
Patients are going to need someone to
They can
to
have a
take
max
care
of
of
one caretaker, yes.
one person.
Is it required?
Hey, this is Kelly Lanigan. I think Dr. Stefanski is driving, so I can address this. I'm the operations chief. I'm the Dr. Stefanski's nurse. It is strongly recommended, but we will not turn people away if they cannot come with a caregiver.
Perfect.
But
Thank
it's,
you. That's very helpful.
It's important for patients to have somebody with them. And I think is the point in terms of if they're going to a shelter. Someone needs to be there to help them in that shelter, because shelters are not going to have CNAs running around or nurses running around that can care for those patients. They're going to need a caregiver if they expect to be cared for in that shelter.
And Mr.
They need to come if your patient determines that this is the only option for them. They need to come with their supplies, which is very vital that they understand that too. Not just their medications, but if they have adult diapers, all those kind of basic necessities. So, okay, we can go to the next one. Next slide.
Including oxygen, right?
Yes.
They need to come with their either.
They can come with their oxygen and get the oxygen swapped out, but yes, they need to come with everything they need. Okay, and once again, if you're going to a shelter, you don't get to pick, oh, I think I want to go to the shelter in Alexandria. It's possible you would have to go to Shreveport. So they need to understand that you're not necessarily going to be close to home. Okay, next slide. Okay, unlike other regions, Region 5 does stuff a little bit differently. First of all, we very much appreciate the at-risk registry being accurate and up to date. However, we use it only for planning. This is when I look at that at-risk registry and our public health folks, when we're looking at that together, we're going to go, okay, hey, state, here's how many ambulances we're going to need to support an evacuation. Just because you have patients in there and you indicated they need assistance, we will not be calling them and checking on them. We're going to be depending on you as an agency to making that contact and then contacting us. So just to let you know, here's how the flow of information will go. If you're a home health or hospice and you know someone needs assistance, we expect you to call the Medical Emergency Operations Center so we can work on getting that transportation to the medical needs shelter. So that's really key. Now we have in Region 5, we have a spectacular hospital nurse with public health, and together she and I will be contacting agencies prior to an evacuation and just making sure we all are on the same page. But in Louisiana Region 5, do know whether you're home health or hospice, we are not contacting your client, and we are not going to assume that they need some sort of special assistance. So we expect that we have to have that call. Okay. Now, if you're
Liz, and you want them to contact you by email or by phone?
Oh, okay. You're going to contact each of your local parish offices. So, and also I will be publishing a number at that time that can reach me or a medical EOC representative. But I'm only publishing it like once we get started. So it's very easy to contact us, but that's what we depend on. And all of our parishes agree this is the way we expect this to go. So like if you have a citizen or maybe somebody that's discharged, a citizen's going to go, hey, I can't get to the parish pickup point because I am, for whatever the reason is. So the parish is going to get that call and they're going to make that, and they may get this information. They're going to get referred to 211, and 211 is going to say, okay, all right, it's possible you may need, you can go to the general population shelter, but you may need a paratransport. You're used to living at home just because you're in a wheelchair. You do not go to the medical needs shelter. So we're working, with the parishes. They'll determine that. Also, we all have a medical liaison within our local parishes, and they're going to say, we're going to need, no, this patient really is bedbound. That's when we, as the medical EOC, are going to get that. And the medical EOC, working with our EMS, will put your patient in the queue and make that determination of getting, when an ambulance would be dispatched if that was what's determined is needed. And at that point, the medical EOC is going to say, hey, wait, are they eligible for the medical special needs shelter? And they'll determine the type of transport needed and make the arrangements to be accepted at the medical needs shelter. So for us, if in doubt, you call your local parish or the number that you have from me published through my emails. I have a very robust communication with my non-hospital providers. If you're not on that list, please look at these contacts, or if you know someone, because I send out a lot of information, especially during storms and things. So make sure you're in my communications list because I use it a lot. Okay, so
you're talking about Region 5 protocol. Is the protocol in Region 4 similar?
I cannot speak to Region 4. Region 4?
It is. This is Kelly.
This is what y'all kind of anticipate doing too?
Yes, like you said, the calls go through 211. We do work with our parish EOC for those unique, transportation needs. If 211 feels that they are not appropriate for a general medical shelter, then at that point we will have our own triage phones, activated, and we can separate out those individuals and push them to a medical special needs shelter, as needed.
Right.
I had, I think her name is Danielle Maples, listed in Region 4 as the hospice and home health link. Folks, should they direct their inquiries through her and then it works its way up? Or is there someone in Region 4 that agencies should contact directly about patients?
I think Danielle is a fine option.
Okay.
Yeah, Danielle's my
And
counterpart.
she's, I'm sorry,
Yeah, Danielle is in the same
Danielle's your
position I am.
counterpart?
Yes,
Yeah.
yes.
Okay. Okay. So if you're if your patient's in region 4, then you need to go through Danielle. If your patient's in region 5, it needs to go through Liz, correct?
Yes, and
Okay.
I'm literally in a medical EOC. I've got EMS. We're all sitting there together. Our public health emergency preparedness person, we are looking at each other and working through these things together. So I'm sure that in Region 4, that should be something similar.
Right. Okay. Thank you.
Okay, and the next slide is just the parish if you want to go to the next one. Oh, wait, I'm sorry. I did want to say one last thing, and that is you're in we may be sitting in Calcasieu, but your clients are in Beauregard. Your parish EOC is going to have visibility of what we're doing with their citizens. We're going to have a documented a real-time spreadsheet showing the status. They're in the queue for transportation, or EMS has dispatched an ambulance to them. So we still have a lot of visibility, but this is just the way the information should flow. Okay, so we can go to the next one. And this is all the parishes, their main contact numbers. If you know that you have a client that's going to need that kind of assistance, that you can call that or call the numbers that I publish, and it'll get to the medical EOC. And that's the right way to do it in Region 5. And the last slide is my, next one is just my email. And if your agency if you're not getting email from me and you operate at all in Region 5, please send me your information so I can get you my contact list. And Jamie, that's all I have.
Thank you. Thank you. Thank you. Does anyone on today's call have any questions for Liz in Region 5, or anyone that's on today, or anyone on today's call for Region 4 as well, since we have folks from both regions on? Are there any providers with questions about anything you heard? I know I have several folks in the chat that are saying our company submitted a list. They did the update last Wednesday on actually Thursday. All I can tell you is what the computer tells me. And you have a patient in there that wasn't. If you have one patient or you have 50 patients, it still alerts me that that patient was not updated. And it may be because that patient is deceased and you haven't taken them out, or maybe you had a reason. Maybe the patient is on an extended vacation for the next 4 weeks, and that's why you left them off. That may be the reason, but it's still going to flag you as having a patient that's not being updated in that report. And again, I don't know the reason that you're not updating that patient. So those of you who are identifying, if you think that those patients should have been updated, if you did the update, something went wrong and we need to see what it was. So please give me a call. I'll give you my contact information right after today's phone call, and we can look at it this afternoon so that it doesn't happen again this Friday when we send out those messages, send out those reports. Yes, ma'am.
Hey, it's Kim from Region 3. Is there, like, when we're doing the compliance for the hospitals, if they don't report by 10 a.m., you are marked non-compliant until that next update is due. Is that the same for this particular part of the at-risk registry?
Well, that's what the algorithm is set to do with the software, and that's why I get the alert.
Okay, so do you know
It
what the
doesn't.
time your cutoff
We don't.
is?
The software doesn't use non-compliant. It just says it didn't happen.
Yeah.
You know,
Do you know
if
what
it's
time
not
that is?
documented, it didn't happen. Mhm.
Yeah. Do you know what that time is for that program?
I'm sorry.
Do you know what the time for, like, is it midnight on Thursday or Wednesday?
No, I mean, people could actually update them up until the report. All the reports, it's triggered to go out at 7 a.m. every Friday morning. So
Okay.
technically, someone could come in at 6:59 and do the update at 6:59 a.m. and still get and still be compliant.
Okay.
We send out a reminder asking them to do it by the close of business day, the business day on Thursday.
Okay, thank you.
Okay. Any other questions? And folks, those of you who have said that you did the update last week, but your name's still on this list, give me a call. Something went wrong, and we have to figure out what it is that went wrong. And I can only do that with you on the phone and me behind the curtain of the software, so that we can figure it out together. Okay, this is a updated list of Lunch and Learn recordings. If you want to attend them, there's a link for you to attend. If they've already happened, there's a link for the recording. Please feel free to click on any of those and use them with your staff members as in-services, especially during hurricane season. These are what's underlined, what's hyperlinked here. These are videos from previous sessions that we did in regions 1 and 9 and the Mississippi Gulf Coast. Immediately after today's session, I will be turning this into a video that we will link so that folks in regions 4 and 5 can go back and review what we've talked about, or if they were not able to be present today, that they could hear what we talked about. Or are there any other questions or announcements? Okay, I'm just looking at the chat box to see if anything came in. I don't see anything there, so I just want to remind everyone that we meet every Wednesday from 1 to 2, or however long it takes, 1 to 1:30 if there's not a whole lot going on. Next week, we will be looking at regions 2 and 6, which are Metro Baton Rouge and Alexandria. And these are particularly important regions for the entire state, because this is normally the regions that accept medically needy patients and have shelters for them. It's not the only places, but those are the primary places. And so we look forward to hearing from regions 2 and 6, not only in terms of other things in their regions that they want to talk about, but also the importance of them receiving the patients from the rest of the state into their region in an actual emergency. I want to thank everyone who's on today's call for your time and your attention. If there's any other questions or comments that you have, please state them now. Otherwise, I look forward to chatting again next Wednesday, July 17th at 1 o'clock. You have my contact information here. I will be converting this video into recording and then posting these slides. They will be posted in the July 17th calendar invitation and Zoom link. So if you want to get a copy, if you want to download this for the hyperlinks or any of this information, you need to go to next Wednesday's calendar invite at 1 o'clock, where the way you sign in for every week's session. Okay, folks, be safe. Please update your registry in time. It looks like we may start getting some activity. I'm hearing there's no activity reported, at least in the New Orleans area, in terms of tropical systems, at least for the next 7 to 10 days. So that's good news. Things they do expect to start picking up after that. So we need to be prepared always. Take care. We'll see you next week.